Good morning, everybody. I hope you are all doing fantastic. If you were paying attention to Facebook or Instagram, heck, I might even have thrown it up on Twitter yesterday. We finally have our high-pressure oxygen concentrators installed, ready to rock. So now we can really start to do some really, really cool stuff with the hyperbaric chamber. So today, I've been talking a lot, so has Dr. Gillen, over the last several months about inflammation and hyperbarics, or HBOT. So that's what we're going to talk about for today's video. So inflammation is an integral finding in numerous medical conditions. I think we can all agree with that. And it coincides with nearly all types of injuries and results to the body. Numerous studies have reported chronic inflammation in Alzheimer's disease, atherosclerosis, autism, cancer, stroke, diabetes, traumatic brain injuries, also known as TBIs, and many other health conditions or chronic disease processes, which is pretty wild. Like, that's telling you right there, that's one of the issues at the heart of the problem. HBOT has been demonstrated to substantially reduce or attenuate inflammation throughout the body. HBOT drives increased levels of oxygen into the body, which travels through your plasma, subsequently reducing your inflammation and pain levels. Studies have shown that HBOT increases anti-inflammatory levels and provides increased cellular aid to help heal target tissues or targeted regions. As inflammatory levels as oxygen serves as one of the primary mechanisms to reducing inflammation, it's kind of a big deal. HBOT helps create a positive environment, or an environment where this process is stimulated and enhanced. Studies have demonstrated benefits of HBOT for inflammation with the following. I'm going to run through a huge list here, okay? You can help support your anti-inflammatory processes at the cellular level. So we can decrease acute and chronic inflammation. Like if you've ever reached back and felt your SI joint, some people call that their hip, and it just feels kind of gritty in there. That would be chronic inflammation. Or if it's puffy, it increases anti-inflammatory cytokines, accelerates fibroblast activation, helps minimize pain and discomfort, and reduces swelling. You can also help reduce neuroinflammation with HBOT. Reduces autism symptoms, reduces the risk of Alzheimer's and Parkinson's disease, and it helps support the prevention and treatment of stroke. There's a really cool research article, which I will link. I don't know if it's going to show up. It was done back in 2008 that goes over some of that. You can help decrease GI inflammation or gastrointestinal inflammation with HBOT. It helps remediate osteoarthritis and rheumatoid arthritis. It accelerates the recovery from sports-related and high-impact injuries, think car accidents. It helps reduce tendinitis. So if you have like tennis elbow or golfer's elbow going on, biceps tendinitis, all sorts of things. It prevents the onset of chronic inflammatory related diseases as well. It helps reduce cancer risk and prevents progression. It helps reduce diabetic conditions linked to inflammation, and it reduces the risk of atherosclerosis, heart attack, and stroke. So let's go over that in a research article. It was published back in July of 2008. Researchers examined the effect of hyperbaric oxygen therapy on atherosclerosis and apolipoprotein E deficient knockout, APO, EKO, in mice. 2 groups of mice were treated with 5 or 10 weeks of HBOT, whereas 2 other groups remained untreated and were used as control groups. After the introduction of low-density lipoprotein, or the bad cholesterol, the treated group exhibited positive changes in the immune and inflammatory responses. This represented a critical component of the beneficial effects of HBOT. The study also demonstrated that HBOT significantly reduced the circulating levels of LDL that can cause heart disease, kidney disease, and stroke. Additionally, HBOT resulted in substantial attenuation in the production of pro-inflammatory cytokines in the response to an inflammatory stimulus. And it showed a marked increase in the production of anti-inflammatory cytokine interleukin 10 by your spleen, or by spleen cells. The observed improvements were already noted only after 5 weeks of treatment. Pretty wicked awesome. I will get this copied and posted into the video. And if you guys and gals have any questions or comments, feel free to drop them in the comments section or give the office a call, and we will get back to you as soon as possible. Have a great day, P.L.L.C. See ya.